Roundtable on Advocacy and the COVID-19 era. Thank you.
Thank you.
Take care. Bye.
All right.
Hey guys, let me just wait for Maria to get on.
Okay.
All right. Maria, have you joined us yet? Give us one moment, everyone. We're just waiting for Maria to connect.
Sure.
Very sorry, everybody. I'm on computer number 3 now, trying to stop all these technological issues. So good to see everybody. For those of us who joined us for the last panel, I mean, wow and amen, and we could have gone on forever. I really appreciate the team and our speakers for our previous call. I hope everyone enjoyed the conversation and this event all day today. And I will add, from a logistical standpoint, I'm pretty proud of us for staying on point in terms of our time. So that is a rare thing in an in-person and definitely a virtual event even. But I'm very excited for this community roundtable, which we are going to dive into the conversation here. And I encourage our attendees to submit some questions. Under the poll section, there are a few things. There are some polls. I'd announced at the beginning of this event that we will be hosting moving forward, a patient advocacy alliance to help elevate the connectivity between industry and patient groups here in Georgia and potentially beyond. So please be sure to give us feedback to inform how we move forward with those programs. So again, bear with me because I've got 4 screens in front of me right now. So I might not be looking exactly at you, Representative. So with that, I just want to dive into this. So first, I'd like to ask you to introduce yourselves. So Representative Schofield, why don't you go ahead and go first?
Well, thank you. And good afternoon or good morning, everyone. I'm State House Representative Kim Schofield. I'm serving the Georgia General Assembly, and I am also the co-chair of the Georgia Council on Lupus Education and Awareness. I am a patient and a clinical researcher at Emory University, working with the Grady Lupus Clinic. And more importantly, I'm a person that lives with lupus. I just also want to thank Dorothy and Georgia Bio and the 34 pharma companies that have come together to have this very important conversation. So in my role, I work to close the gaps between health equity, health disparity, and try to move that needle between policy and advocacy. Thank you.
Thank you. And Howard?
Yes, and good morning, everyone. I'm Howard Mosby. I spent 2.5 decades with the Grady Health System, managing the relationships between Emory and Morehouse, understanding the physician relations piece, also training the next generation of doctors. Also started a nonprofit called the HEAL Collaborative, and here we conduct programs at educating the community using primarily the faith-based community to deal with this issue of trust that we've heard in the previous sessions in how we get information, translate information from the healthcare setting to the lay setting. And so that we can build, we can fill this chasm, this gap between how healthcare is designed and delivered and how people actually access healthcare. So I'm excited to be here.
Great, thank you both. So as people submit their questions, we're going to go ahead and get this started with some questions that we had discussed that are important. The tried and true advocacy tactics have had to change in the light of COVID. I'd like to kick off this discussion by asking each of you, what does advocacy really look like in this COVID-19 era? Kim?
Well, you know, advocacy as we know it is all about the voice, and it's all about mobilization, activation. And so in this era of COVID, and COVID has really thrown a monkey wrench in taking our systems, disrupting them, and then putting them back together to expand our reach. We discovered there were so many gaps. So when we think about advocacy as it looks today, we've got to continue to be creative and innovative. And what that looks like is really creating that space where advocates not only have a voice, but they are so important in influencing policy, laws, budgets. And so they actually shape the narrative. So it's no longer just allowing us to be at the table. We have a right to be at the table, and we now have to come in with a plan and strategy. And that includes removing some of the barriers to clinical trials, to access to affordable care, to making sure that there is inclusion. And all of this has to be intentional. So when we talk about what advocacy is and some of the best practices, it is creating that space, whatever that space looks like today in COVID. We'll probably delve in that a little bit later, but to make sure that people not only have a seat at the table, but the conversations are being implemented and activated in a way that touches everyone's life.
No, definitely. And we definitely touched on some of that in the patient physician conversation and the clinical trial panel today. So Howard, I'd like to expand on that, and specifically what changes must an advocacy organization make given that they cannot have in-person meetings with legislators or even host events?
Yeah, this is a tough time. How many of you are zoomed out now? You know, when you're sitting in these meetings, not saying that this was a great one. Let me just say that, but but you sit in these meetings, and if the content isn't going in the direction that you as a participant don't like, you have the whole world at your fingertips. And so you can go on Facebook, TikTok, or whatever the thing of the day is for you, and you get lost in an important point that's come across as an advocacy organization. So your members might miss out on something important. The other thing that we need to understand is that COVID actually can dominate the conversation. So when we're looking at cancers or cardiovascular metabolic disease or issues that you're advocating for, COVID is actually taking a lot of the oxygen in the room out of the space, and people are focused on that. So we really need to make sure that our advocacy organizations stay on point, keep their members together, and understand that in this environment, you really still have to stay engaged, and people continue to be plugged in and connected to one another.
No, definitely, and thank you for all those important remarks. It is definitely sucking a lot of the air out of the room these days. So Representative Schofield, could you please speak to some of the specifics about adaptation for populations an advocate may serve? What might engaging the audience look like in this virtual environment? I've heard everything from Twitter chats to Zoom, of course, and drive-in movie event type of things. So any ideas and suggestions?
Well, you know, COVID again has disrupted, but there are just been some benefits. And when we talk about advocacy, what a great way to start mobilizing a lot of different groups at one time in one room. We all can't get to all of these different meetings, but if we were to implement some of these tools that we have from Instagram Live, and what it does is it helps expand our reach and our access. So we're now engaging more health groups and health policy groups, advocacy groups in spaces that we've never been invited to before. So I think, you know, one of the things that we should be looking at is how do we build capacity how do we expand our network and our relationships? Who do we need to have on these Zooms, or how are we reaching these audiences? When we look at the patient engagement, do you really understand what is the need of the voice for the patient? The barriers, but what is that true need? And so I think what this does is gives us an opportunity. If you're trying to reach the younger people and involved in healthcare issues, then you've got to go TikTok. You have to start doing Instagram Live. Everything is live, but just imagine the scope of the community that you can engage that are now home in a place that will get involved in community groups and start having those conversations and those dialogues. See, it definitely has intentionality to reach across every spectrum right now. From making sure, as someone said earlier, about that we see research, we see the diversity in the doctors, we see people that look like us, talk about us, and know what we're talking about. So when we talk about those social constructs, that's when you start dealing with the social determinants of health and other barriers. The inclusion is to expand your network, expand your relationships, also get and be in tune to advocacy groups, and then lastly, get media. Get involved in bringing your media along to further expand the need for change. And your legislators and your policy people are hand in hand. You have more access right to reach legislators. In 3 words, I will tell you to reach a legislator is tweet, email them, and then post. So you want to tweet to them, tweet to their pages to get your topic heard, get your voice heard. You want to email them consistently, and you want to post on their pages.
That's great. Thank you. Do you have anything to add to that before I pivot to the next question?
Hey, no, I think you need to email your legislator and bug him or her to death.
No, that's fine. Yeah, borderline harassment, right? And I will say, even in this environment and hosting important events like this, we've had to be very intentional about our outreach and our invitations because everyone is so zoomed out. So you need to make sure that the content isn't just noise like it can be sometimes, and that it's really meaningful to the audience you're trying to reach, and you're reutilizing those relationships and partners and collaborations to get the message out, which goes to my next question regarding education, Howard. From where you sit at Leading Heal, you're fully aware that we need to educate in order to mobilize. In the past, we did in-person briefings. So what does education look like? Which I realize goes hand in hand with the previous question a bit, but we need education in order to mobilize. In the past, we did in-person briefings, but how do we do that now? Are they as easily transferred to Zoom and YouTube and Facebook Live and other platforms? And do you have any other suggestions to add to what Kim said?
Yeah, first, because I used to be a legislator, so that's why I said that about Kim, so I put that on. But anyway, I would add that you know, the advocacy organizations and doing things on the internet is probably not that new. What's new today is just that everyone else is now meeting this way and approaching issues in the past as advocacy organizations. Turning on a dime was pretty easy. You pick up the phone, call people and say, we're going to have a meeting down at the Capitol or down at XYZ Community Center to discuss whatever thing is going on. Now you have to get people online to do it. It seems easier, but it's harder today because people are being pulled, again, in a number of different directions on the internet. So we really need to be conscious of the fact that as advocacy organizations, how you stay connected to your group, to your people. As you said just earlier, internet noise and traffic can really distract you. And so this is where you really need to make sure that your relationships are true, that they are stable. And so that when you pick up the phone and call someone, they understand and know that this is something serious that we need to get to. We also need to make sure that our contacts that we have, that they are indeed solid and that we have trusted allies in this space, in this landscape that we can go to. So it's a tough environment right now. Advocacy organizations really just need to lock arms and make sure that they understand that their members are being pulled in different directions, but they need to stay in close contact with them.
Definitely. And education continues to be key. Legislators, as both of y'all know, get a lot of different topics thrown at them from all types of industries. So, and this is very important and very timely. And I would add, Kim, I think you alluded to this earlier, this is also an opportunity to utilize the noise that COVID is creating to further elevate a lot of the disparities we see in certain populations that are impacted by COVID in particular, and making sure the patient voice is even more elevated than it typically is. So we should also use this as an opportunity and be creative in a lot of our outreach. So with that said, Kim, Representative Schofield, I'd really like to hear from you. What role do you see Georgia Bio playing with the advocacy community? What value can we add, particularly with COVID really changing the societal dynamics? This is a new area in many respects that we're diving into very intentionally, and I'd really just like to hear from you what you think we could do.
I think Georgia Bio is really doing a great job. First of all, anywhere that Dorothy Leone Glasser is, it's already going to be big and it's going to be bold and it's going to be great. But saying that, I think what has happened is you guys have been a great voice on the cutting edge of where we are today. So when we talk about how do you expand that, it's making sure that you're engaged on every platform. Again, legislatively, healthcare, research, pharma companies, the advocacy groups, and you are that bridge and that connector so that when we do come together, you have your hand not on the pulse, but you are creating a pathway for others to follow. So what you have done through opening this conversation is not only, as we always have these conversations of saying, okay, what we must do, what we should do. Our next step now with that you are doing is saying, we've heard what has to happen. And I was just sharing with my colleague, Howard, that we've got to now take that and say, demand, this is what we need. This is what we've got to stop taking and settle for the excuses of why we don't have the diversity in research. We don't see the doctors that look like us. The pharma companies, we've got to start being intentional on saying, no, we're not going to support initiatives that do not support people of color. We're not going to support clinical trials unless the inclusion, exclusion criteria reflects us. We're going to be the conveners of health literacy, and we're going to start shaping policy. I think you guys are in the best position to be not only the drivers of that bus, but to get us to that destination by mobilizing a large group and keep putting pressure on not just state legislators, your federal legislators on every level. That's how you start changing the game, when we stand up and say no more and enough. And here's what we are going to do right now.
No, that's brilliant. And thank you for that very, that excellent advice. I do think we sit in a good position to help with that convening and coordinating the community as best we can, and also providing industry expertise and allowing patients to provide their voice to the industry. Partners like Pharma, who's a sponsor for this event, full disclosure, are really important to that. The relationships they build with policymakers at a state and federal level are really important. And another project we work on, we always say, really to make something successful, it's about people, people, people. And I think that's more important than ever when it comes to policy and educating those decision makers in the policy realm. So Howard, I'd like to pose one more question to you. How can advocates engage in community stakeholders in particular? We know you're connected to Grady and you're a leader there, but in order to connect with them, in order to move health equity policies forward for next year, going into a very unusual legislative session, and how has COVID changed any of those engagement practices with community partners?
And thanks for the question. And actually, to the prior question, we've done great with Amgen. I know they're a sponsor as well, but we just want to make sure that I reach out. I shout out to Holly Snow because I don't want her to jump on me. But anyway, here's the deal about your question. I don't think the community stakeholders are. I don't think community stakeholders are your problem, and COVID has pulled back the covers on inequitable healthcare policy. So health equity lies somewhere between policy and profit. Where policy meets profit, there is somewhere is health equity. Policymakers can hold profiteers accountable for equitable decisions. However, and we're going to call profiteers people who are in this space that are specifically just looking to increase shareholder wealth, usually have a strong influence on policymakers. So in this environment, advocacy organizations need to understand the full equation of how organizations are set up to advance their agenda and how the community's agenda needs to interface in that. Kim said it earlier, we need to start demanding what it is that we want out of the healthcare space to close this gap on health equity. And so I would like to see going into the next legislative session that our advocacy organizations start the process of reaching out to policymakers now. And because we're in this virtual environment, it should be easier than before, because they're not out in Timbuktu saying I'm doing X, Y, Z. You're online just like I am. I need to get to you to let you know that we're coming at you this year. The other thing that people, advocacy groups need to understand is pre-filed legislation. So how do you access legislators to get your issue on the books before the legislative session starts? You can do a lot of work between now and January, the second Monday in January, to get your issues on the forefront instead of waiting until after the session starts. So this is a great time. During COVID, actually has opened up this window for advocacy groups to get out there and get on the front side of this. So I'm excited about that.
No, I couldn't agree with you more. Like I said earlier, definitely there is some opportunity here, but starting early and also refining your message so that it is succinct, and that top line message is right there for someone to consume is really important. We're coming to the end of our time, so I apologize. You know, in this virtual world, we do try and keep things shorter because, just like most people, our focus is waning at this point on digital events. So I just want to give you both an opportunity to make any final remarks. And Representative Schofield, I'll start with you.
You know, this was a great session. I do wish we had more time. To Howard's point, now is the time for you to connect with your legislator to make sure, as we're going into pre-filing, we want to make sure that we are addressing every topic and not just for the sake of the addressing. I personally want to see some heavy action stated. I wanted to see steps taken. I wanted to see that we are working and they're moving in the right direction to no longer keep having conversations, but let's start getting some good sound policy on the books so that we can create a space where we can close this gap. We know Georgia has not yet fully expanded Medicaid, but in the meantime, what do we need to do to close this gap of health inequities and disparities? We need to start having more rural physicians that are available in some of these specialties. We've got to be able to come to the table. And then what I've also done in closing is I've gathered a team of young professionals as well as high school students and start having conversation of what health disparities looked like to them. They are the ones that are going to take that next generation. So if I can influence them who are not old enough yet, but can go back and impart in their family members how to start changing and making lifestyle changes and how to start understanding health literacy and reach back and have these hard dialogues. This is the time now. We don't have any more time. Our time is up to accept this status quo. Work with your legislators. We're people too. Thank you.
Definitely, and I totally just back you on that comment about starting with our youth. I volunteered with Latina teens for over a decade now, and working them to not only help educate them on health issues, of course, but also helping them understand how to overcome any cultural issues, right, whether that's due to they're from different countries and different cultures, or if just different cultures here in our own backyard even. So I think teaching young people how to overcome some challenging conversations is important around health equity and many other issues too. Howard, any other remarks from you?
Sure. First of all, I'd like to thank our sponsors here, specifically Amgen again, and Georgia Bio for putting this on. Your support of our organization to bring together policymakers, the community, and faith-based leaders to discuss how we close the gap on the equitable delivery of healthcare to underserved communities is paramount. This conference, this session, is how we address health equity as a public health crisis. But this message is also directed to pharma in that you must continue to financially support organizations that look like the community that you're targeting to assist. You must not be a party to restricting the growth of those organizations through minimizing or reducing funding for direct effort programs that are designed to help the community, but are set up to only give back shareholder wealth information. So we want to make sure, I just want to put this out here to say, hey, the community, the underserved community, the communities of color, actually have a trust issue here. And I think pharma has done a great job in trying to understand that, but now's the time to actually push this over the cliff so we can really get some big change and big movement in this area. So I just want to thank you all for putting this on to start that process.
No, and thank you for joining us. We did get 2 last-minute items in here, and Hal, who you're on our planning committee, so I do want to acknowledge your comment, and as someone that is trained in public health and prevention, I think what your comment is important. It is not just about funding, it is also about access and alternatives, but that goes along the lines of education. So we do need to reflect on, like you say, our life conditions, our lifestyles, and simply the infrastructure challenge that might prevent us from good access. And so, I don't know if you have any comments on that, but I think it's all about health system strengthening in many respects in order for us to really continue to work towards allowing better access for patients to a variety of things. So. And finally, Liz, I did see your question, and I'm happy to also help take this offline. Yes, people with ME and CFS and chronic fatigue syndrome do face a clinical care crisis, just like many other diseases. I'd love to tackle the conversation offline about why it needs to be taught in medical school. I do think it's important and as someone that's an advocate in the rare disease space in particular, where in medical school, CJD gets 3 sentences in a medical school book over the entire time. I completely relate to that. It is important to continue to educate and talk to legislators, but also engage, leaders in the medical community, like the American Medical Association and other groups that help build that curriculum that our universities and other institutions use. So unfortunately, it's not an easy answer to that, but it does go back into what this whole day has been about, and that's advocacy and education. But so the question was, could our legislators help get a disease into a medical school curricula? Any comments from either of you? And Howard, I know you're at Grady, so I don't know if you even have any comments.
Yeah, that's tough. Actually, probably going to Congress, it's a better idea. So if you look at the ACGME, American Council on Graduate Medical Education, they set the guidelines for that. So it'll be great to just type them out a letter to say, hey, you guys need to really think through this. And medical schools generally follow their guidance.
And again, I say that, you can help work with your legislator to facilitate some of these issues. I know that I work with the American College of Rheumatology, and there's some certain things that we're looking for in medical education. So it's always good to connect to the medical groups as well as the legislators. As many people as you can bring to the table, the better off your voice, the stronger your voice becomes.
Yeah, and then just to close on that, we recently helped a friend actually start a venous malformation nonprofit herself because her child has it. And she realized there was no NGO helping create that voice. And it only started about 6 months ago. So it is about coordination. And sometimes, just because you're an individual, sitting at home, taking care of your kids, that's my friend, and thinking you don't have a voice, you can create a voice for yourself. And she did that through Facebook and mobilizing people and using her contacts and her contacts, which is how she found me, to really help get coordinated. So also, I just say, believe in yourself and your ability to make some noise around the important topics like yours. So again, thank you to you both. And before I transfer this over to Dorothy to close us out, I just want to thank once again our speakers and everyone that joined us today, all of our attendees, and especially our sponsors, Amgen, Pharma, and UCB, who are ongoing supporters and partners of the organization. Thank you not only for this, but for your constant support. And next year, I hope that we can be in a place to convene in person, as my wish is to provide a more robust and enhanced program with more interactive opportunities and programs for patients and industry to connect. We did what we could virtually in 2 hours, and I know there's plenty and never-ending list of things we could discuss. But again, thank you to our sponsors, our speakers, the outstanding planning committee, and our chairs for your patience and understanding as we as a staff pull off a new event for ourselves. Additionally, all the technology fun we've all dealt with. And then a reminder to people to please complete the polls in the section, check out the patient testimonials and email us any patient testimonials, because we're going to be making that available at our big Bioinnovation Summit in November. Get your story out in front of, quite a few hundred people in Georgia and industry. Send that over to us. Recordings will be available for about a week. And hopefully beyond that, we just got to figure out the technology beyond that. And finally, all of our patient advocates and attendees are invited to join our summit November 4th through 6th if you're interested. And we will continue to collect those patient stories. So with that, I'd like to turn over to Dorothy to close us out. Dorothy?
Thank you. I just want to thank everyone for being here today and to realize that we are in a pivotal moment in healthcare, and we can see this COVID crisis as an opportunity for us to all be advocates for healthcare, to end these barriers of disparity, and to, with disparity, never forget the cultural incompetency that we are also overcoming. We really thank the biopharma industry because as advocates, we want to partner with you. We not only want a place at the table, but as Representative Schofield said, we are driving the bus, and we want to make sure that everybody has a seat on that bus. So we have a lot of influence. We work all year long with our legislators to be able to bring the topics that are most important to the forefront so that they're aware of what the advocacy community needs, what patients need. And at a time like COVID, when we're also facing, a lot of people are facing homelessness now, poverty, so many other terrible burdens on them. They should not have to worry about getting the health care that they need. That should be the last thing that people should have to worry about. This summit was so motivating to hear all the valuable information from all of our speakers. And it's our first step to develop this Georgia Bio Patient Advocacy Alliance. And I hope from what you heard today that you will bring this back to your organizations and to your communities and want to be part of this for us. We can take this information and we can do all the work that there needs to do. And believe me, there is a lot of work to do. Some of us here have been doing this work for over 40 and 50 years, and it never, ever ends. So we need you. We need you to come on board with us. We need you to tell us what is your priority for a better healthcare delivery system. What are the challenges and the barriers that you are facing? And what can you give to this new alliance that will pave the way for us to be able to change policy, to be able to give all Georgians the health care and the delivery system that they deserve. Just be inspired by what happened. We intend to do more of these types of summits and conferences. So please continue to give us your feedback. And we're going to be getting in touch with you and giving you a summary of some of the topics. I took a lot of notes today that we feel are important and that we want to be able to get you on board with. Your voice matters, and we are here to lift up all the voices of those who are not heard. Thank you so much for being a part of this today.
Great, thank you. And now for a message from Pharma to close us out. Thank you everyone for joining us today.
So my mom passed away in her sleep. She had a heart attack, heart failure. She was 57 years old. When I was first diagnosed, I was in denial. That's the only way I can describe it. I was in denial. I felt overwhelmed, and I think my biggest thought was, am I going to pass away like my mom did?
It's a big challenge, but the challenge in itself is what keeps me going. The disease, it's like a battle, it's like a war. We're trying to fight against these diseases. And so it's a determination to really say, you know, I think we can make a difference here.
I think my biggest fear was just number one, being sick, because up to that point, I never had anything wrong with me. And just really having to take medication and go to a doctor regularly for a condition was just something that was brand new. And I did not have my mom to call to say, you know, guess what?
I would tell them that there's a lot of hope, that we're making breakthroughs every day, that we're gaining insights into the disease that they have every day, and that there are scientists working in the pharmaceutical industry that are determined to develop new treatments to help them. So I think the future is very bright, it's very exciting. We have technologies and opportunities that we've never had in the past.
I think anything is possible. And the thing that I love about the universe, yes, is that things are always being revealed to us. And so the more that we have people who are intentional about being scientists, and the more that we have people intentional about bringing all of their information and their expertise together, I am very, very hopeful and very, very optimistic about a cure being found for cardiovascular disease, and thus high cholesterol.
Thank you to Pharma for that important message. And as a final reminder, thank you to our sponsors. Wear your masks, exercise your right to vote, and everyone remain safe and well. Thanks all.
Bye.